Go ahead and get started. Good afternoon, everyone. Welcome to the TA Network's Cultural and Linguistic Competence Peer Learning Exchange. The Peer Learning Exchange is a webinar and monthly call with topics focusing on culture, health equity, and disparities in children's behavioral health. Topics are generated by you, individuals working in or being served by behavioral health organizations, and those partnering with systems of care, states, and communities. The TA Network, as it's known, is the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration, or SAMHSA. My name is Linda Callejas. I'm an assistant professor at the University of South Florida and direct the Cultural and Linguistic Competence team of the TA Network. And I'm happy to introduce our presenter today. Today's webinar is the first of a four-part series on implementing the CLAS Standards. Today's webinar will focus on language assistance and implementing language assistance plans in particular. On June 1st, we'll be hosting our second webinar on language assistance, which focuses on using interpreters. On July 13th, we'll host another webinar on recruiting and hiring a diverse workforce. And on August 3rd, we'll conclude this series with a webinar on culturally and linguistic competent leadership development. Today's discussion will be led by Catalina Booth. She's the Executive Director of the Center for Community Learning in Miami, Florida. In her role as a member of the TA Network, she's focused her work on CLAS Standard implementation and has developed materials designed to educate administrators, practitioners, and consumers regarding the history and the purpose of the National CLAS Standards. She's also conducted training on culture, cultural identity, and how to implement the CLAS Standards. In addition, she's authored or co-authored briefs and TA tools designed to help systems of care better understand and implement the CLAS Standards at the organizational level. Before I turn the mic over to Catalina, I just want to remind everyone that this presentation is being recorded and that your lines will remain muted to help eliminate background noise. So feel free to use the chat box throughout the presentation to type in any questions or comments while Catalina is presenting. Following her presentation, we'll open up the lines for further questions and discussion. So without further ado, I'd like to turn the time over to Catalina Booth.
Thank you, and welcome to everyone. I'll begin with a minor disclosure in that hopefully this won't happen, but we might be interrupted. I do have a 6'3" at home with me. I work from home. So no BBC interview incident, hopefully, but just wanted to let you know that. She's pretty good, so I think we're all set to start. Before we start on the objectives of this webinar, I want to alert you to the fact that you have files available for download, and I'll tell you when you can download them at any time. I do recommend that if you want to follow along and you want to read the actual text of the CLAS Standards, the second document on your list of files for download is the National CLAS Standards, the Enhanced National CLAS Standards. So if you want, you could go ahead and look at that and open that, and if you wanted to follow along and look at the language while we go through this webinar. So we have three main objectives today, and those objectives are to understand the need for language assistance, and secondly, to review the requirements for language assistance under the CLAS Standards, and finally, to explore tools for implementing language assistance plans. Then, as Linda said, today's webinar will focus on language assistance plans, and then next month we'll dive further into other forms of language assistance, such as interpretation. In this next area, what we're going to do is I'm going to show you a video, and I'm going to share my screen and play a video for you. Oh, sorry. I shared the wrong screen, so let me try this again. If you can't hear it, let me know. via the chat box.
I'm so sorry. She's been crying nonstop. She has a temperature of 105. I don't know what to do.
I'll be Corona to the side.
No, please. Every time I see her, she throws up. I don't know.
Be Corona to the side.
Look at her. No, she's burning up.
You brought it la anglan.
What? She's burning up. Feel her head. What are you doing?
What do you have?
My baby, she's got a temperature of 105. Every time I feed her, she throws up. Please, can you?
Tienes que le por temporal.
She's burning up. Feel her head. Please, feel her head. Feel her head. Just someone let me in. Anyone understand what I'm saying? Please, someone help me.
8% of U.S. citizens speak limited English. For these 25 million Americans, professional interpreters can mean the difference between life and death.
And I'm switching us back to the screen. Give me a moment here. Sorry, my mouse is giving me. Each and every time that I watch that video, and I've watched it many times, it provokes some very strong emotions. And I think a lot of us either have been in situations like that or know people in situations like that. And I play that video because it's a very visual and very effective reminder of why we need language assistance. Language assistance can put us and can put the people we serve and know in our community in some situations like this. The demographics in our country are changing, and more individuals find themselves in the same situation as the young mom with a sick child. They have a pressing health need or behavioral health concern, but they do not have the ability to communicate with their providers. And the census data supports this reality. According to the U.S. Census Bureau, more than 1 in 5 U.S. residents do not speak English at home. Of that group, about 4 in 10, or 25 million, have limited English proficiency. The Migration Policy Institute gives more detailed information, and that's some of what you see in the graphic, that more than 60 million, actually it's up to 64.7 million, or 29% of U.S. households, report speaking a language other than English at home. And Spanish was the most common at 62% of those households, followed by Chinese at 5%, Tagalog at 3%, Vietnamese at 2%, French at 2%, Arabic and Korean at those percentages, then followed up by German, Russian, and French Creole at about 1% each. With the number of households with families that are linguistically isolated by their limited English proficiency, disparities arise. Many cannot access services or they don't receive appropriate services because of their language and communication needs. Now we understand there's a need, and that's what the figures show. But let's explore how language assistance prevents situations like the one in the video. Think back to the video we just watched. If the front desk at the clinic were trained in cultural competency and understood the importance of providing language assistance services to reach all types of cultures and languages, the mom would not have been in the situation she was in. So language assistance is needed because it opens doors. Furthermore, research shows that health outcomes are better when using culturally and linguistically appropriate services. Minorities, linguistic and cultural and ethnic minorities, and all types of other cultural minorities are underserved in the behavioral health field. Language assistance is one way to open doors to services and remove barriers. A study of mental health service use among, for example, a study of mental health service use among suicidal adolescents reported in 2010 in the Journal of Psychiatric Services found that foreign-born non-citizen children were 4 times more likely the non-immigrant children to report no visits to mental health specialists the previous year despite having a need for it. Low acculturation and linguistic isolation of parents are considered to be the biggest barriers to health care use by immigrant children. Language assistance is a way to reduce disparities and achieve equity. If we provide everyone with the exact same thing, some will still be unable to participate in access service. Look at the illustration. If our only concern is equality and we give everyone wanting to watch the game the same size stool, the youngest boy still will not be able to see the game. However, if we focus on equity or fairness and we give each person the tools they need, all three boys will be able to see the game. Same thing happens in behavioral health care. We need to look at individual cultural identities and language assistance needs and provide access that is equitable and meets those needs. We need to understand what people's language and communication needs are and address those specific needs in order to provide equitable services. One tool that we have to open the door and provide equitable behavioral health care services is the CLAS Standards. The National Standards for Culturally and Linguistically Appropriate Services, known as the CLAS Standards, are a set of 15 action steps intended to advance health equity, improve quality, and help eliminate health care disparities by providing a blueprint for individuals and healthcare organizations to implement culturally and linguistically appropriate services. There are 15 standards, but there is one principal CLAS standards that basically serves as the mission statement for the CLAS standards, and that gives us a lot of guidance onto what the purpose and means of language assistance should be. The principal CLAS standards state that the purpose of the CLAS standards are to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. I highlighted some important terms in the principal CLAS standards that define the guiding principles for language assistance. And one important thing that you'll see here is preferred languages. Sometimes we think that we only have to provide language assistance to those that cannot speak or understand the language. But the CLAS standard says that sometimes there's situations where we might have participants that need language assistance services, despite the fact that they have a working knowledge of the language, and we'll watch a video regarding that later. The guiding principle is to provide quality care and services that are responsible to all communication needs. It's important to note that communication needs are not limited to language needs, but also to health literacy levels and other communication needs. In this webinar, we will not focus on health literacy needs, but it's a very important consideration, and we urge you to review the TA Network's resources regarding health literacy. And those are available for download, and they're called health literacy resources. Today, we're going to focus on the 4 CLAS standards that deal with language assistance and communication needs, and those are CLAS Standards 5 through 8. These 4 CLAS standards are mandates that stem from the Title VI of the Civil Rights Act of 1964, which prohibits discrimination based on national origin. And furthermore, there was an executive order issued in 2000 that states that people with limited English proficiency should have meaningful access to federally funded programs and activities. Therefore, to all of us that receive federal grants, either directly or indirectly, we're covered by this executive order and therefore are mandated to provide language assistance services. These are the 4 CLAS standards that deal with language assistance, and I'm not going to read them phrase by phrase, but rather I'm going to give you the key points. The first CLAS standard, CLAS standard number 5, requires organizations to offer language assistance to those with limited English proficiency or other communication needs at no cost. The next CLAS standard number 6, requires that organizations let individuals know that they have a right to language assistance. In other words, it's not a policy that stays in a folder in the filing cabinet, but it is a policy that requires, that should be announced to all who come in the doors and participate. The next class standard, standard number 7, requires organizations to make sure that those providing language assistance are competent. And it's a key factor, and one of the ways this comes up is a lot of times organizations, for example, I've been in situations in hospitals where there's nobody who speaks the language of the client, and just like in the video, and they grab a patient or they grab a family member to try to interpret. That is a case of absolute last resort. And the guiding principles of the class standards state that you should avoid that and should have in place a way to provide competent and qualified language assistance. And we'll talk about what that means as we go through the plan, and then in the next webinar when we talk about interpretation. Class standard number 8 requires that organizations provide materials, key documents, and signage in the languages most commonly spoken in the community and in the populations they are serving. And as we go through what it means to have a policy, a language assistance policy, I'll go through some tips on how you can determine what languages are most frequently spoken in your community and how you can address that. So now I am going to share my screen again, if Gary can give me that option. I'm going to get ready to share it. And we are going to watch a video that was produced by one of the grantees in Broward County. OCPT partners put together this video, and it is a good example of what happens when you don't implement the class standards. Okay, here we go.
Hi, Rachel. It's Karina. How are you? Hi, Karina. How you doing? What can I do for you today? I was thinking about what you just said, and I think I'm ready to make the appointment with the therapist. Of course, of course. I am so glad that you're open to this. I know the Wellness Associates accepted your insurance. Do you want to try there? Sure. That's close to my house. Okay. Let me see. See here that I have a Dr. Jones. He is accepting new patients. Do you want to try him? Actually, do they have any providers that speak Spanish? Well, what you need Spanish for? You speak perfectly fine English, don't you? Honestly, I do, but I'd rather see a Spanish-speaking therapist. Do they have some at that office? I can check. It'll be harder to find an appointment for a Spanish speaker. One moment. I will see. Okay, I see there's Mr. Rodriguez. Do you want me to check to see if he speaks Spanish? Sure. It looks like he speaks Spanish, but he's not accepting new patients. I think that you should go with Dr. Jones. Your English is perfectly fine for a Hispanic person. No, Rachel, I am fully bilingual, but I will be more comfortable opening up to someone who speaks my native language. Karina, you are being very picky here. You know how hard it is to get appointments. Rachel, I'm so sorry if you feel like I'm being difficult. You have to understand that even if I speak perfect English for Hispanic, like you said, I communicate my feelings and emotions in Spanish. Seeing a therapist who doesn't understand my culture will be a waste of time. Fine. I will look for a Spanish-speaking therapist in a different office and get back to you. But in the meantime, you should consider speaking with Dr. Jones. I'm pretty sure you do fine with him. There's nothing wrong with your English. Thanks a lot, Rachel. I appreciate it. Talk to you soon. Bye. All right, bye. As a service provider, you're entrusted to provide equitable care that is responsive to diverse cultural needs, including diverse health needs. When receiving care from any service provider, you are entitled to receive services in your preferred language. A list of available services and other resources through provider agencies should be available for providers to assist you. If service providers are not available, you can request language assistance at no cost to you.
And thank you to Broward County OCP2 and all the partners who made that video possible and allowed us to use it. It's an excellent example of how failure to plan and implement the CLAS standards can create barriers to care. But it's also an excellent example of how grantees and communities can take creative approaches to informing their participants of their rights under the CLAS standards. It doesn't have to be just a poster on the wall, but there are creative ways to let your different populations know about what the CLAS standards are. So how do we make language and communication assistance a reality? I want to make sure everyone can see the slides. If you can't, somebody let me know. I think we're good. So how do we make language and communication assistance a reality? Well, you plan first and then you implement. And that's what we're going to be talking about, making language assistance services, effective language assistance services, a reality through planning and implementation that is consistent with the CLAS standards. And I call this strategic planning for language assistance, and it has 5 steps. The key to providing effective services that meet diverse language and communication needs is to plan strategically. You start first in the red box by assessing language and communication environment. What I mean by that is that you need to understand the needs, and you need to assess and understand your communities and your population of focuses communication needs, including their language needs. You must understand language proficiency in the community being served, as well as any other possible communication needs. The next step is to define your language assistance goals. You need to create a language and communication assistance mission statement. This doesn't have to be anything complicated. We'll look at some examples later, but it's something to focus your attention and to focus your work as you draft this plan. The next step in the purple box is to assess available resources and challenges. Take a look around and see what's available to you and what challenges you might face. The next step is to develop language assistance plans and adapt to the needs and challenges found in the earliest steps. The next step in the orange box is to implement your language assistance plans, including detailed action plans, resource plans, and budgets. You don't ever want your language assistance plan to be a dead document that sits somewhere in a filing cabinet and never gets implemented. You want it to be a living document with resources to work with. Let's take a look at each of these in detail. We'll start with the language environmental assessment. What do I mean by a language environmental assessment? Well, the first step is to determine what, if any, need there is for language and communication assistance. You need to have a good understanding of what your population of focus needs and what the community you serve looks like in terms of languages spoken and other communication needs. And you start by determining what languages other than English are spoken by the populations of focus in your community. And you determine what percentage of the population you serve or are planning to serve has limited English proficiency or other communication needs. Remember that some may appear to be proficient in a language, but may still need language assistance. So how in the world do you do this? I'm going to walk you through two resources. So I'm going to share my screen. And the first resource we're going to look at, and this website is available, the link is available in the resource list that you can download at the end. And I'm going to walk you through how you can use it. It's called it's on the Census Bureau website, and it's called the Detailed Languages Spoken at Home and Ability to Speak English for Population 5 years and over. And you want to look at the data for counties. That's the data, the data that you want to look at in this case. And you click on that, and it'll download a document. And it's already downloaded to my computer. It'll download an Excel sheet. And I'm going to open that Excel sheet. In my case, I live in Harris County, Texas. So I would type in Harris County, and it leads me to the data. As you can see, for those households that have limited English proficiency, it goes through the numbers, what languages are spoken in each home that has limited English proficiency. And the highest number here for Harris County is Spanish. As you can see, there's over 1.3 million households that have limited English proficiency and speak primarily Spanish only. And then as you scroll through, you can see the other languages and see that the numbers start getting large again in terms of most common language when you get over here to the Asian and Pacific Island languages. So if I was planning a language assistance program in Harris County, I would want to take a look at the most common languages in the county I was looking at, and if there's any more detailed data by neighborhood, to look that up. And then that could determine what the most common languages spoken in my community are. And in the case of Harris County, that would be Spanish, Chinese, and Vietnamese. Another really interesting resource that uses census data, but also uses data from other sources and puts it in a visual way that is very helpful, is the Community Commons. You'll have to join it, and there's no fee for it, but you can actually look up some very helpful data for your community. Again, let's take a look at what data they have available regarding language needs in each county. I'm scrolling through to Harris County, and then I click on View Reports, and then I'm going to look at population with limited English proficiency. I click on that. It generates a report. I can, and then I can actually, if my mouse cooperates with me, I can scroll down and look at that report. You can also download it, but for purposes of showing you what the report does, it'll tell you what percentage of the population has limited English proficiency in that county. And it provides, and you can even start looking and using the map to narrow down on a particular neighborhood or zip code. And then it gives further data based on race, ethnic background, and so it correlates language isolation with other factors that may be helpful as you do your service plans, and as you create your language assistance plan, or even your behavioral disparity impact statement. So those are the tools that I wanted to show you at this point. If I could find that, yes, Gary's helping me out. We're going back to the regular screen. And Gary, we have a dark screen for some reason.
It might take a second to come back up.
Okay.
Yeah.
Thanks, everyone, for your patience. Technical glitches are always
I'm going to navigate to another layout, and then I'll navigate back, and hopefully that'll remedy it.
Okay. In the meantime, as a reminder, if you have questions, please use the chat box. Linda is helping me monitor those questions, and we will address them at the end. We will also unmute your lines at the end for a question and answer period. Yeah, I'm still seeing that one. I don't know if everyone else has the same one or if it's just on my end.
So I think it's on your end.
Okay.
Yeah. Let me try one more thing. I'm going to unshare the document and reload it up, and hopefully that will make it show back up on your screen.
Okay. If that doesn't work, I have the printed slides that I can.
Yeah, we can certainly go that route as well. Not a problem, and I'm happy to move the slides forward if we go that route. And Catalina, has the screen come back for you? Okay.
No, it hasn't. So I'll just have to go, we'll have to go blind on my end, but that's okay. If you can go to slide 18, define language assistance goals.
All right.
So those two websites that we just looked at are examples of places that you can get the data, and that data is going to help inform what your language needs are. And of course, you also want to add in any personal knowledge you have or partner agencies that can help you narrow down and figure out which are the most commonly spoken languages of your community and your populations of focus. Once you have that data, then you can go to the next step, which is to define your language assistance goals. The CLAS Standards 5, 6, 7, and 8 provide a framework, and now you can personalize them to your community's needs. For example, you can state in your plan that if you were in Harris County, I'm going to use Harris County as an example, an agency in Harris County. Your sample goals would be to offer free language assistance to individuals seeking services who have limited English proficiency and other communication needs. And then for the CLAS Standard number 6, your goal would be to inform all people seeking services of the availability of language assistance services. Provide written notice in English, Spanish, Chinese, and Vietnamese, and provide I Speak cards for those individuals speaking less common languages. Next slide, slide number 19.
All right.
Then you could further define your goals as for the next few standards as providing certified translators in the 3 most common languages spoken in your county. In this example, English, Spanish, Chinese, and Vietnamese. Obviously, you don't need a translator in English. That's a mistake on that slide. And then the last one is to provide easy-to-understand key materials and signs in English, Spanish, Chinese, and Vietnamese. So those are just examples of how you can tailor and more narrowly define your language assistance standards goals so that your plan is tailored to the needs of the community that you are serving. The next step after you assess the need, written out and stated your goals, is in slide number 20. You will need to assess the resources available and the challenges you may have. Knowing the needs and knowing your goals, what you want to do at this stage is to determine what services, what resources are available to you now, or what things are you already doing, and what challenges may you face or are you facing. So you want to look at and check the availability of translators in common languages, the availability of phone interpreters or language lines, other resources like language lines or online resources. And then you want to look at and assess the availability and skill level of bilingual administrative and clerical staff. And by that, I mean you want to see how many of your staff, both on the intake and administrative side and on the service delivery side, are bilingual, and how many are able to deliver services. So at times, you may need to determine whether you want to create a way to assess their language skills and make sure they can do the work in another language. And another area you want to assess is to determine if cultural brokers are needed and readily available. And this whole topic of cultural brokers can be a webinar in and of itself. I want to give you a basic definition, but know that we will cover it a little bit in the next webinar. But something you want to determine is if there are cultural brokers in your community already that can help you deal with populations that speak other languages that you are trying to reach. And cultural brokers serve as intermediaries that bridge the cultural gap by communicating differences and similarities between cultures. They may also serve in more in-depth roles, mediating, negotiating, and they serve as liaisons, cultural guides, and mediators. For example, Maine has a large Somalian refugee population, so they have created a network of cultural brokers that work as community health workers. So if you were a grantee in Maine, you would have the availability and you would be able to tap into that resource. So that's what you want to look at. So you want to look at what resources are in your immediate community or surrounding communities that may help you provide language assistance. Next slide. And actually, you can go to the next slide, 22.
All right.
Since I can't see the chat box, we can't do that part. So now it's time to actually develop the language assistance plan. You looked at the needs. You've looked at possible resources. You have your goal set. Once you have, the first thing you need to do is determine who needs language assistance. Let me start that again. There are 5 key components of a language assistance plan. And if the screen sharing function works, I'll show you one in a little bit. But the 5 key components of a language assistance plan are to determine who needs language assistance. You need to figure out a process for determining whether or not the people that come in your doors need language assistance. And you need to write out all the steps for that to occur in your plan. The second component, the second section of your language assistance plan, is to identify the language that individual who walked in your door speaks or other communication needs. Many organizations use I Speak cards, which are available online, or other ways or picture ways of determining if a person comes in and you don't immediately know what language they speak, they can point to a set of cards that have flags that will help you determine what language is. And this is in situations where you get someone come into services in a language that's not one of the ones you most commonly speak, but encounter, and something you might be unfamiliar with. But it'll help you deal with those situations that are not the routine, that might be languages, uncommon languages. The next key component of your language assistance plan is the procedures for language assistance services. You need to think through and write out the process for hiring and retaining translators, procedures for using other language assistance methods like cultural brokers or translation of materials and interpreters, and then translation of vital documents. And let me correct myself. You need to look at the process for hiring and retaining and using interpreters. I just did this common mistake that a lot of people do sometimes is using those two terms interchangeably. An interpreter is someone that interprets the speaking orally, and a translator is someone who translates a written document. So you need to have available interpreters that can provide language assistance on site if necessary or by phone. And then the fourth key component of your language assistance plan is you need to think out and write through procedures for the methods of providing notice of the language assistance services, what we talked about in the beginning. How are you going to let your participants and your community know that there are language assistance services? Many, you might use an innovative method like videos that you have available and playing them in different languages, or signs that let people know that language assistance services are available and how they can access those services. And the fifth component of a language assistance plan is methods to train staff and service providers on language assistance policies and procedures. It's not enough to have a policy and have it in the drawer, but in order for it to work, the people on the front line who see participants day to day need to know what the language assistance policy is. They need to know how they can, what they need to do in order to determine what language needs that person has, and they need to know how to access the services that you have lined up. If the person working your front desk does not know how to contact the Spanish-speaking interpreter or the Chinese interpreter or the language line that you may be using, then that language assistance plan isn't very effective. So those are the key components, and they're important at every stage. Sherry, are we able to share screen, or is that also gone?
Okay, let's find out. I just navigated to that layout. Are you still seeing a black screen?
I have, yes.
Okay. If you want to try logging out of the Adobe Connect window and then logging back in, that might reset it. If we just take 30 seconds to try that.
Well, for the interest, let's keep going, because actually
Sure.
in the list of documents that you have available is one called a language access policy template. If those of you who are able to who are in front of a TV, in front of your computer screen and can download documents, if you could go ahead and download it, I'll point out some key features. This is not an actual language assistance plan, but it's an outline with guiding questions that can help you develop yours. And it's created for smaller agencies, so it is streamlined so that you deal with the things that address the needs and are compliant with the CLAS standards. And one thing you will notice is that with this template, it has you, the third item it has you define is your target population. And it's something we discussed about. It actually has in your language assistance plan, it helps you to verbalize who you're serving, and then in other later items, how you can serve them. Another key component is that it has you walk through the guidelines of how you're going to provide language assistance to those that need it. And it breaks it down into two categories. The first on page 2 is interpretation. That's oral language services. That would be an interpreter or a trained bilingual service provider, trained and qualified bilingual service provider. And then the next step is to provide written translations of vital documents. And vital documents are things that are essential to the provision of services. And we can certainly answer questions about what documents a vital document, but basically for our purposes here, it's things that people need in order to access services, such as their intake sheets, any assessments that they have to fill out, any questionnaires that they have to fill out in order to create a service plan, and also any privacy notices that you're going to give them. Those are things that are considered key documents. If we could go back to the slide deck.
All right.
And we would be on slide number 24. Is that up now, Gary?
What's the title of the slide?
Continuous Improvement for Language Assistance.
All right, you're set.
Okay. And now that you've developed a plan, or at least outlined a plan, it's time to implement it by creating action plans, resource plans, and budgets. And that's step number, the orange step. And I want to make sure that we all understand that having it in writing is one thing, but we also need to have worked with partners, boards of directors, project directors, to make sure that there's budget and there's resources to actually provide those services. Because if you have a written plan, but there is no way to pay interpreters, then your plan isn't really going to work. And then the last step of the process is to continuous improvement for language assistance. It's to actually go back and look at and assess what you've been doing. And there's actually one of the class standard number 12, which is not one of the language assistance class standards directly addresses this. And class standard 12 states that organizations should conduct regular assessments of community health assets and needs and use the results to plan and implement services that respond to the cultural and linguistic diversity of populations in the service area. And that's exactly the process that we've used to assess our needs, assess our community assets, and develop a plan. Next slide, components of language assistance self-assessment.
Okay.
When you assess and you want to see how your plan is doing, you need to understand how the limited English proficiency individuals interact with your agency. And then you need to see if you're properly identifying them and if you're identifying and assessing their needs, and whether or not you're effectively implementing language assistance services, both translation and interpretation. Next slide, components of language assistance. Then you want to see if staff is being properly trained and that providers are properly trained and they are doing their job in terms of language assistance. You want to assess whether there's proper notice of language assistance services, and then monitor and update language access procedures, policy, and plan. Next slide, 27 examples of language assistance self-assessment.
All right. You can go, Catalina.
Okay, and if those of you who want to take a look at it, I want to draw your attention. I've provided two examples of language assistance self-assessments, and I want to focus on the second one. If you can click on that link, it should be live, and it'll pull it up directly so that you can look at it. And this is the language assistance toolkit that Covian Consulting created for the TA network a few years ago. Starting on page 22, has a language assistant policy assessment that asks guiding questions that will help, that you can answer yes or no, or in process that will help you determine what you're doing effectively, what you're addressing, and what gaps there may be. And the questions are things like, my organization offers language assistance through the use of certified interpreters. My organization evaluates the work of interpreters on a quarterly basis. Different things that will help you assess how you're doing. And we recommend that when people are going through the organizations are going through the self-assessment process, that they not only have staff and service providers complete these assessments, but they also engage community members, family, youth, and young adults in this process to help answer those questions. because you as an administrator, or a policy person, or a service provider, or a peer worker may think that you're providing the services and they are effective. Those receiving the services may be able to give you more insight into how this policy is being implemented, whether or not it's effective to meet their needs. Next slide, advice from the field.
Go ahead.
Okay. This can seem overwhelming. So in these next couple of slides as we wind down the webinar, I want to give you some concrete advice, what I call advice from the field. The first piece of advice for you is to gather and commit, to gather around a group of people that are committed to developing this language assistance plan or assessing your existing language assistance plan, and make them champions of language assistance. And you want to include people at all levels of the organization, including those receiving services. You want to write down what you already do to provide language access. If you're starting and you're new to this and this is your first language assistance plan, I bet you there's already things your organization is doing that fulfill the requirements of the CLAS standards. You just need to think those through and start at that point and then determine what else needs to be done. Next, you need to assess where you can grow and strengthen your language access policies and practices. And I put on here, you need to plan for the future. If right now the statistics say that the most common languages spoken in your community are English, are Spanish, Chinese, and Vietnamese, but you know there is a large number of Burmese immigrants now living in your city and they are part of your population of focus, you might want to plan for the future and think about how you can address those needs as well. And my key piece of advice from this slide is, remember, a marathon is not a sprint. You're not going to have a detailed, complicated language assistance plan from day one. If you could go to the next slide, slide 29, examples of immediate steps.
All right.
You can start with what I call baby steps or introductory steps, which is simply posting notices that inform people of their right to an interpreter. Developing a handout to help staff quickly connect to language access resources. For example, any interpreters in the community or language assistance lines. And translate simple, vital documents into the languages most frequently utilized by participants in the community served. And the next slide, which says resources, a reminder that we have created a list of resources with links to a variety of examples of language assistance plans, data resources, and other resources that can help you through this process. So please be sure that you download, that you click on that, and that you download it. And I believe that we will also send an email to all those participants that registered that will have that attached to it. So if you miss it, we'll try to get it to you. And the next slide is our contact information. If you don't even know how to find qualified interpreters, or you don't know what a language assistance line is, please feel free to contact any of us. We can give you more assistance in helping you develop that. And also keep in mind that we will address a lot of those issues regarding what makes a qualified interpreter, how to find interpreters, and how to work with interpreters on the next webinar in June, the first week of June, the first Thursday of June. With that, we can unmute the lines, and we have a few minutes for questions. And Linda, if there's any questions via chat box, if you could read those, that would be great.
Okay, I think Linda had to step off.
Okay.
And hold on one second.
I'm here.
Okay.
I'm connected by phone, so I did. Okay. There is one question, or an excellent question towards the end, in terms of what are the expectations for social media and other forms of, communication in that regard, with regard to the language access. So more is written and, yeah.
There is a really thick, by what I mean thick, there's a guidance document that was issued by Department of Health and Human Services, which defines all of that. But I can narrow it down to say that is use your best judgment. If it's social media like that is the only way that people have to engage, then you should try putting it into the most common spoken languages. So you have to use your judgment on that, and that's probably something we can help you guide through because it's a very technical. But I think the key resources, what they mean is things like intake forms and things that if they do not complete those and if they do not understand those, they can't access services. So it's a judgment call, and it doesn't have to be in every possible language, but just key languages of the languages most commonly spoken in your service area. There is a guidance document. If you Google Health and Human Services language assistance guidance document, it'll come up, and then you'll get a headache, and you can call me because it's totally in lawyer language. I can help you decipher it.
Great, thank you. Are there any other questions or comments?
And I'm just going to jump in real quick. We're experiencing some technical difficulties. There's some lags on my end, and it's not allowing me to unmute the global mute. So if people could put their questions in the chat box, that would be great.
Thanks, Gary.
And while people gather themselves in, this is an area that you can go to the TA network regarding assistance in providing some of these services, translation and interpretation. So if there are particular needs that you have, then we can help connect you with resources. Are we getting any questions in, Linda, or are we doing it?
Yes, one second. We have another question. Is this data available for the catchment areas of individual high schools?
To answer your question is yes and no. Yes. The U.S. Department of Education also requires schools to gather information regarding language assistance needs. But I think they're done by school districts. So if you have I can start digging for that. I saw a link to that. So whoever asked that question, if you can shoot me an email reminding me to send you the U.S. Department of Education link or a way to get those resources, then I will try to connect you to that. But yes, yes, that's to school districts, unknown if it goes to a particular high school.
And do you know, Catalina, that was Jim Gillespie who asked the question, but do you know, I have an additional question, how readily available those data are for just folks, outside of the school system? Typically, you may have to, enter into some sort of request that from the school district, or do you know how readily available those are?
That's a good question. My understanding is that because they don't disclose individual information of students, there shouldn't be any privacy issues. The U.S. Census data, there is some data within the U.S. Census data, like what they call the community survey, that is based on that data. So in other words, it's collected by the Department of Education, but it resides in the Census Bureau. That's why I said I think it takes a little investigative work, but it can be found. So email me. I will get to work on that, and I will, if you email me, and then when we send out the recorded link of this webinar, maybe Gary can attach that resource for everyone. Great.
Kathleen, it doesn't look like there's any more questions coming in
Okay.
right now.
Well, thank you, everyone, for joining us. We're at our 1 hour, and just encourage everyone to join us next month, the first Thursday in June, which will be June 1st at the same time. We will be talking about implementing language assistance services, more specifically how to work with interpreters, and we will be joined by one of the interpreters and translators that does work for the TA network and other systems of care communities. Thank you very much.